We are going to demonstrate a glycolic acid peel of 35% today on this patient. So I would like all of us to concentrate on the patient's skin and face, and I would like to discuss why we are doing a glycolic acid peel in her. First of all, she has active acne, which is grade 2 acne. Earlier she had grade 3 acne, but with a good course of antibiotics and topical agents, her acne is well under control. However, she still has residual pustules, she has papules. You can also see she has post-inflammatory hyperpigmentation. I'd like to point that out to you. So you can see areas of post-inflammatory hyperpigmentation, which partly could be due to excoriation, but partly also more inflammatory acne and repeated episodes of acne itself can lead to post-inflammatory hyperpigmentation. Apart from papules and pustules, she also has a few comedones. She also has a very seborrheic skin, and she also has very early scarring, as you can see. Very early scarring. They're not deep pits at all, but you can see the beginning of some early rolling scars beginning to happen, and this is because this patient has been suffering from acne for many years. She is currently not on oral isotretinoin, and she has stopped retinoids, topical retinoids and topical glycolic acids 2 days before, and we will tell her not to use it for 5 days after the peel. She is already on a sunscreen, she is already on a moisturizer, and we would urge her to continue to use a topical antibiotic such as clindamycin even during and after the peel. But we would also stop benzoyl peroxide. So now we will show you the steps of the peel. Are you comfortable?
Yeah.
The hair should always be neatly pulled back. If preferably you could even put a shower cap. Some patients don't like the feeling of a shower cap, but you could encourage that. So the hair should be neatly tucked away. Before we start the peel, it is absolutely vital and essential to pre-cleanse the skin in a particular fashion to optimize the uptake of the peel and also to optimize the safety of the peel. To do this, you have actually today many options. The classic traditional way to pre-cleanse is to use spirit followed by acetone followed by spirit. My tips to you about this method of pre-cleansing is that 1. Don't take too much on the cotton ball. So I can show you that when you take the spirit or acetone on a cotton ball, just to show you, when you take the spirit on the cotton ball, you should soak it, but it should not drip. It should be moist, but it should not drip. And this is also true for acetone. So we do spirit, acetone and spirit. When you apply the spirit, you should not rub it against the skin. The idea is to degrease but not to irritate or excoriate. Otherwise, your peel may take up in a different fashion than what you expected, and you may actually get a severer response or an unpredictable response. Also, watch out for excoriated areas such as here, and I would suggest that you do not apply spirit or acetone on these. Just to be on the safe side, you can take a moisturizer and cover those areas, as we will show you in the next step, to ensure that you do not accidentally wipe over those areas, because those will not only burn, but they'll actually lead eventually a very intense post-inflammatory hyperpigmentation. So starting off is that we would start with spirit, then apply acetone and then apply spirit again. However, with time I have found that patients, when they smell the spirit and acetone, get extremely nervous. Some patients they're not as seborrheic as you think, or they have very sensitive skin. So they actually overreact to the peel, and sometimes your peel has gone off great, but it's the pre-peel agents which have actually irritated the skin, caused excessive dryness, and the patient doesn't wish to do a peel again, or they react unfavorably. So what I have done is, over the years, I have modified for certain patients with not such seborrheic skin, patients of adult acne, patients who are known to have sensitive skin, patients who have mature skin, which is on the drier side. We in our clinic like to use a mud pack. This is a soft clay pack which we apply for 10 minutes with a soft brush, and just a little water mixed together in a soft brush, evenly applied. Remove it gently with wet cotton, and then we proceed to perform the peel. And prior to using the pack, we just use a gentle soap-free cleanser, then apply the pack, then start the peel. There are other agents which are known as pre-peel agents, which come in different forms. Certain companies and certain peel companies have now designed not only the peel, but they've also designed a pre-peel cleanser and a post-peel neutralizer. The whole idea of this is that the pre-peel cleanser actually starts maintaining the pH balance of the skin, which makes the peel actually more acceptable to the skin. So it creates a sort of base over which you apply the peel. So it's not a cleansing agent as much as a preparatory agent, and then you apply the peel. After that, you neutralize with the post-peel cleanser, which is typically sodium bicarbonate, but it is specially formulated to neutralize the pH of that particular peel. So it's a very specific neutralization which ensures greater safety of your peel. Another form of degreasing could be a more general product which has a pH of say 5, which is closest to 5.5, which is desirable. It also contains 5% glycolic acid. So the 5% glycolic acid actually acts as a degreasing and a preparatory agent, and the neutral pH makes sure that it doesn't interfere with the pH of your peeling agent, and that ensures a better uptake and safety. And then you can neutralize with sodium bicarbonate, which you can either prepare or use a product which is readily available. So these are the variations to pre-peel cleansing. Now I'd like to show you the first step, and that is actually doing the clinic spirit, acetone and spirit degreasing before we start our peel. Would you like to cleanse her? Is it burning a bit? Okay.
Yeah.
I think this area we should be careful. So we'll avoid this area while you're wiping, and you can put a bit of moisturizer over it to protect it. So as you can see, as it is being performed, there is no rubbing. Is it burning or tingling a bit?
Little.
Just a little bit.